Welcome to the Explore Global Health podcast. I'm Dr. Rob Murphy, Executive Director of the Havey Institute for Global Health here at Northwestern University Feinberg School of Medicine. Water insecurity is a growing global health issue that impacts nutrition, health, and well-being. Today's guest, Dr. Sera Young, is leading research projects focused on thinking about water in new ways. Most recently, she has led efforts to develop the Household Water Insecurity Experiences Scale, a cross-culturally valid tool to measure household water insecurity. Dr. Young is an associate professor of anthropology and global health at Northwestern University, and she joins me today to talk about her career journey in the field of nutritional anthropology and her work leading international research projects that impact global health. Welcome, Sera, to our show today.
Thanks for having me, Rob.
You're based here at Northwestern in Evanston, the main campus of Northwestern University. But a question I like to ask our guests on the show is, where do you call home? Is there a place in the world, and you've traveled quite a bit, where you feel the most at home?
That's a great question. I would say Evanston is where I've lived for the longest period of time in my nomadic life. I feel quite at home here, but I feel most at home when I'm with people who care about global health. I know that sounds like you told me to say that maybe, but I really do. I'm at home with people who care about other people.
I understand your feeling. So you're a nutritional anthropologist. Can you explain this field to me and why you decided to pursue this subdiscipline of anthropology? A little bit about your background from your CV. You got a BA in anthropology from the University of Michigan. You got a MA in medical anthropology from the University of Amsterdam. And you got a PhD in nutritional anthropology from Cornell University. Tell us, how did this happen?
I'm either a sheep in wolf's clothes or a wolf in sheep's clothes, depending on the company I'm with. Technically, my PhD is in straight up nutrition. I went from highly social science oriented to taking classes that I never thought I would be taking for my PhD. I mean, to get into the program, I had to take general chemistry and organic chemistry concurrently. And so then with that out of the way, I could take biochemistry and eventually nutritional biochemistry while being a grad student. And I would say it was hard to make the transition from qualitative to quantitative stuff, but it made me such a better scientist to be able to engage not just with the biochemistry, but with the epidemiology and the biostatistics that inform my work to this day. So I can run with nutritionists and I can run with anthropologists, and I'd like to think of myself as bridging the two ways of knowing about the world.
Part of your graduate career is in medical anthropology at the University of Amsterdam. Can you elaborate a little bit more on that? I would say for Americans, most of them have not included training in other countries. Can you tell us a little bit more about that?
To answer that question, I'm going to have to take you back to when I was 16 years old. I got a brochure in the mail. Would you like to go to the United World Colleges? And that's a system of schools dedicated to international understanding and community service. And it's where the International Baccalaureate program began. So some of you will be familiar with that certificate. And I said, let's try it. I put my application in, and this was in the good old days when we still communicated by postage mail. And the letter of acceptance saying, yes, you'll be going to school in Wales in September, got lost. And so a month before it was time to go, I learned that I would be spending my senior year of high school and my freshman year of college at this castle in the south of Wales where I was exposed to the world. I am from the Midwest. I was a mildly smart and mildly accomplished Midwesterner who knew very little about the world. But I was suddenly transplanted to Wales, where in the dormitory there was an Israeli and Palestinian girls who were roommates. And I didn't understand the gravity of that. There were soldiers from Georgia. There was chess champions from Hungary. The Dutch king went there. And my eyes were opened so enormously to the world. And I started asking, how are we all the same? How are we different? Why are we different? And that naturally turned for me to anthropology.
So you got set up during this IB type program and you ended up in the Netherlands. What was it like going to school there?
It was really a cool experience because I didn't live right in Amsterdam. I lived just outside, and I was really living with real Dutch people. And I really got to develop my Dutch language skills and really live Dutch culture.
Everyone that we interview on this podcast, everybody identifies the tripwire that got them going towards global health. There's one certain experience that just made you realize you wanted to devote time working on a global scale or in a low resource country? What was that moment for you?
So my first one of those tripwires was when I was a junior at the University of Michigan. I was so fortunate to be an undergraduate researcher for a professor named Beverly Strassman, who was working in rural Mali in West Africa. Thanks to my time at Atlantic College, my French was greatly improved, and that was an important skill to have for research in a Francophone country. And I went there thinking my major was anthropology of religion. And I went there thinking I want to understand more about Dogon cosmology. But my job there was to conduct anthropometry on, I think, 1,100 children under 5 and their mothers. And that was a lot of measurement of a lot of diaperless babies who were not growing as they should, and some children were extremely sick. I'll never forget, there was a 3-year-old child and a 1-year-old child of the same mom, and they were the same size, which is not how it should be. And to me, I thought, wow, it's interesting to understand architecture, but there are some real problems here that need solved. That started me more and more biomedical in my journey from cultural anthropology to medical anthropology to eventually a PhD in nutrition, postdoc, reproductive infectious disease fellow.
So you've already mentioned that you speak a little Dutch and that you speak French. And I also understand that you speak Swahili. So when did you pick up Swahili, and why did you feel it was important to learn Swahili?
Well, for that, I have to thank Rotary. When I graduated from the University of Michigan, I knew I cared about global health things. And I knew also that it was good to not only be in school. So I took the opportunity to apply for a cultural ambassador scholarship, which sounds very fancy, but what it meant was that I think they gave me $4,000 to go live with a Swahili family. So I lived on the island of Zanzibar, which is just off the coast of Dar es Salaam, part of Tanzania. And there's no better way of learning a language than living with a family who speaks that language and who mostly only speak that language. And so I did that, and then that served me well for my PhD, which was on Pemba, a smaller island in the Zanzibar archipelago, where I could really use those language skills to do more global health.
Much of your work is on impacts about food and water insecurity. One of your first big studies on this was in Kenya and was focused on the reduction of maternal and child undernutrition in the first 1,000 days of a child's life. Can you describe that work for me?
I was so fortunate as to land a K Award when I was a research scientist at the time at Cornell that funded me for 5 years to study the impacts of food insecurity in the first 1,000 days among women of mixed HIV status. So what we wanted to do was quantify what food insecurity did, not just for nutrition, but for mental health, for economic well-being, so on and so forth, and understand it within the context of the dyad. And with my nutrition hat on, we know how to measure the key exposure, which is food insecurity. But with my anthropology hat on, I wanted to make certain we were talking to the moms about stuff that they cared about too. So we did something called photo elicitation interviews, which is where you give a woman a camera and say, take pictures of X, Y, or Z, and then you come back and you interview them with the photos that they've taken. We asked them to take pictures of that which influenced how they fed their babies. And we got pictures of things I expected back, sick chickens and failed crops and the dads drinking up the food money, using it for alcohol. But then there were all these other pictures of dirty water that women had to choose between buying food or buying clean water and using that water, of water sources that were very precariously located so that they had to leave their infants behind to go fetch the water, and so on and so forth. So with these photo elicitation interviews, we were receiving all of these pictures of water, which I did not see coming as I was focused on food. But through these conversations, through listening to the mamas, I soon realized that water was fundamental to all aspects of life in a way that I am still slapping myself on the forehead. How was I not seeing this before? Women were not able to prepare the food that they wanted. They were dehydrated for breastfeeding. They were being beaten up when there wasn't water in their household. They were going into debt in order to get water for their family. I mean, it touches all aspects of life. So with my food insecurity lens on, thinking, okay, we measure food stuff by measuring how people access and use it. We measure their experiences with it. We're not just counting the number of calories that are available to them. I wondered if we could do that with water too. So I was a new, fresh K01 baby assistant professor wanting to think, surely someone has figured out how to measure water access and use in a reliable and valid way. so I can pop that measurement in the study design. But lo and behold, such a measure had not been developed. And so we got an R21 to develop a scale that was appropriate for measuring water access and use in Kenya. And anthropologists love comparative work. And I started to see that water problems were a global phenomenon. They're right here in our backyard, even in Chicago. We wanted to develop a scale that was globally valid, equivalent, reliable. And that's the work that I've been spending the last decade on.
You brought up a very interesting point I was unaware of, that you were a KO1 awardee. It's a really wonderful career development award, KO1. And I'll tell you that the NIH is trying to recruit Americans like Sera to apply for them because they think it's not applied for enough. It's really a wonderful award. It's just incredibly supportive, heavily mentored, and everyone ends up doing a great job after they finish one of those awards like you did.
Well, I agree with you. I can't recommend a KO1 enough. And it was because of that opportunity to really dig in deep to what was happening in terms of food insecurity for these moms that I stumbled onto what I think is my best idea so far, which is all this stuff we're doing with water security.
Because of your group's work, we now have a pretty good snapshot of what water insecurity looks like in a variety of different places where you've worked in China, India, Brazil, and much of Africa. How do you want to see this data utilized?
So the UN always has these high-level panels on X, Y, and Z. And so it won't surprise you that they have a high-level panel on water. And in that report, the high-level panel said, we can't manage what we can't measure. And that is true for water. And I agree with those high-level panel of experts. Right now, the common indicators of water have been how much water is out there, so cubic meters per capita. And when you take Lake Victoria and divide it across Kenya and Tanzania, people are water secure. There's enough water physically available if that water was equally distributed. But of course, it's not. So we have good data on physical availability, but that doesn't tell us about what water is in people's lives. We also have another indicator of what water is like in people's lives by measuring people's water infrastructure. So right now, Sustainable Development Goal 6 has as an indicator, tracks the type of water infrastructure that people have. And I would say physical availability and infrastructure are both necessary, but not sufficient for having enough water in your life for basic household domestic needs. And so we aren't measuring well enough that which is so precious to us. And there's kind of a playbook for improved measurements of resources, and we have that from the food and nutrition world. So Sustainable Development Goal 2 is oriented to food and nutrition. And one of the indicators there is experiential measures. So the food insecurity measure that I was using as part of that KO1 is one of the ways we track progress towards food and nutrition for all. My strong argument is that we need to have an experiential measure of water to really know if people are water secure. We need to know if people are worried about water. We need to know if they have enough water for both consumption and for hygiene behaviors. And right now, that is not the global indicator, and we're going to change that.
That's quite a goal. I understand that you and your group actually developed a measurement tool called the Household Water Insecurity Experiences Scale. Can you elaborate a little bit more how your team did this and the impact that's had?
We were in Kenya and we had developed an experiential measure of water access and use there. But anthropologists, they love a good cross-cultural comparison. And so we wrote a proposal that was funded by an amazing organization. The funding mechanism is called Innovative Measures in Agriculture and Nutrition at Imana. And that's an amazing organization funded by Gates and FCDO, the artist formerly known as UK Aid. And they have been enormously supportive of this work. So I applied for a grant from them, was denied it the first time. Second time's a charm, it seems. Sometimes it takes third or fourth. We were funded to develop a global scale, and we were funded for 4 sites. But as I kind of reached out to my networks and said, hey, we're doing this, people loved the idea. And for much of this work, I keep looking over my shoulder to think, surely someone has developed an experiential measure like this. It's so obvious. Coming from nutrition, this is how we measure food security. So there's a good one for Bolivia and a good one for Ethiopia, et cetera. There's nothing that's globally relevant. So mentioning this to my professional network, by the end of the data collection for developing the household version of the scale, I think we had 30 collaborators when we collected data in 28 sites in 25 countries. There were geographers, there were epidemiologists, there were nutritionists, anthropologists across time zones, career levels. And from there, we formed a consortium with UNESCO and Gallup to put these items into the Gallup World Poll. And that is an individually oriented survey. So we switched the questions from how often have you and your household been angry about your water situation to how often have you, just you yourself, been angry about your water situation. And we extended the recall period so that the data were comparable. And from that came the IWISE, the individual water insecurity experiences scale. Both of those take 3 minutes to administer. They're easy to analyze, and they've held up well in all the places that they've been administered, which is now in more than 60, 70 countries, 100 so organizations.
That's amazing. What a great achievement. I'd like to switch gears and get a little personal here, if you don't mind. I understand that you're working pretty closely with your husband, Julius Lux, who's professor of chemical and biologic engineering and co-director of the Synthetic Biology Center at Northwestern. And he's focused on using RNA-based technology to develop a simple, inexpensive test that could determine water quality. Can you tell me about that project and what it's like working with your husband?
I've been really lucky in who I have partnered with. And when our daughters aren't interrupting us at dinner, we like to talk about our research. And so in our stolen moments of talking about science, I was explaining just what people are up against with water contamination globally. And as it happened, the universe was conspiring to bring us together intellectually in that he was working on biosensors. So you know this better than me. All cells need to detect that which is in their environment so that they can move towards it or pump it out or do what they need to do. And he and his group have identified biosensors of key water contaminants, including fluoride. So a little bit of fluoride is good. A lot bit of fluoride is not good. And there are many areas, including along the Rift Valley, where geogenic fluoride is really problematic. He also had identified a biosensor for lead. And so what he's done is made what you can think of as pregnancy tests or at-home COVID tests to detect water contamination. And this is a big deal for a number of reasons. We can detect lead or fluoride in water with fancy machines in laboratories at great cost. What we can't do is do so privately and rapidly in the privacy of your own home. So he's good at developing biosensors. I'm good at talking to people. Engineers speak differently than anthropologists and have different types of questions. But what we did was we identified questions that were relevant for both of us. Do the tests work? And are they sensitive and specific to detecting contaminants? And then can people use them? We have a paper now out in NPJ Water that shows that, in fact, these geogenic fluoride tests work well. And that has inspired us to do the same for lead here in Chicagoland. So we have lead tests that are good to go, and we're about to launch a pilot study seeing if they work as well as we think they do.
You alluded to this already, but I understand you do have 2 children and you've got an incredible career and a busy international travel schedule. How do you make that work? This is a very important question for young families going into global health, and everyone has approached it slightly differently.
There are a few ways that we've made that work. And I think an important one is bringing your kids to the field. Both my girls have been to different field sites, different projects. Another is choosing your partner well. Julius has a lot of wonderful qualities, but one of them is he's very supportive of my career. So a very supportive partner and also supportive family. I mean, my mom has been willing to stay with the girls and make things happen that would not have been able to happen otherwise. So I'm very appreciative of her as well.
One last comment and question. I ask this of everybody who comes on the podcast. What advice can you give our listeners, especially the students, people early in their career who want to get into the global health space?
Creativity is underappreciated. I think that we all think we should know things and do things in certain ways. And I would encourage people to be comfortable to ask the questions and do the science the way that they are best suited to do that science. You know, you go in and you have questions that you think you need to have answered, and those are the ones, and that's what you have the grant for. But if you can take a minute to not abandon your own, line of reasoning, but to listen to what people are telling you, it's transformative. I mean, the same thing happened in my master's degree. I was studying anemia during pregnancy. And I was studying on how people understood it and how they treated it. But then people were telling me something about eating dirt and anemia. And I was like, this is interesting. So I spent the summer asking, why are women craving uncooked rice? Why are they craving this earth? And they finally said, you tell us. We want to know too. Like, look at you with your clipboard and your cassette tape recorder. You tell us. And so, that listening to them, they got me on a trajectory that led to a well-received book and lots of publications. And again, listening to the women gave me the idea to dig into water. But being willing to say like, hey, this is an important question and it needs answered. And I'm just going to draw on the techniques from this field or that field to do so. So being yourself and being creative, those are nebulous, but key. Another is apply for a K award. Money is not only power, it's time and the ability to really dig into both food insecurity, which then led me to water insecurity without having to do a bunch of teaching, was priceless. So I would encourage grant applications. And a piece of advice someone gave my husband early in his career, he was complaining that he didn't get a grant. And this person said, if you're feeling bad about not getting a grant, you're not applying for enough grants. You need to just take rejection as part of the process. It happens to everyone. My third one, if I may, is have fun. Life is too short for always doing the slog. And if you are if you're answering questions that you care about and find to be important, this gig is pretty fun.
Dr. Young, thank you very much for joining us today. It's been really great opportunity for us to hear about all the important things that you've done in this field and your career development and how you got there. I think it's an incredibly valuable resource for us to have. And just thank you so much for joining us.
It's been a pleasure and an honor to be on this. Thanks for having me, Rob.
Follow us on Apple Podcasts or wherever you listen to podcasts to hear the latest episodes and join our community that is dedicated to making a lasting positive impact on global health.